Ahead of ACL this year, the head of Austin Public Health put the area back into stage 4 of the city's risk-based guidelines today. We'd been in stage 5, the worst stage, since early August. Jenny Lee is live outside Ascension Seton Medical Center in Central Austin to break down what this change to stage 4 means. Hi, Jenny.
Hey, Brian, remember, these are just guidelines, which means they're not binding or enforceable, but they do cover what public health officials want the public to do as we are winding down in this third COVID-19 surge as it subsides. All right, for vaccinated people, this means the guidelines continue to call for masks in public, but stage 4 relaxes the recommendation against private gatherings, travel, dining, and shopping for high-risk people. For the unvaccinated or partially vaccinated, not much changes here. APH still advises no private gatherings, no dining out, takeout only, and travel and shopping only if it's essential, and of course all of that with a mask. So not a huge change, but an indication that things are improving, Brian.
And thank goodness for that, Jenny. We've been watching the numbers improve, cases, hospitalizations, ICU beds for the last couple of weeks now. How are the hospitals holding up along with the front line nurses and doctors continuing to treat COVID patients each and every day?
Yeah, good question. For this, I had a conversation with Dr. Donald Murphy. He's a member of the Texas Medical Association's COVID-19 task force. He's also a pediatric infectious disease specialist. He says that while ICUs are not completely full, they are full enough to keep doctors like himself and nurses extremely busy. On top of that, remember, hospitals like Seton here still dealing with that big nursing shortage, not just here in Austin, but across the state and frankly across the country. And on top of all that, remember, 95 to 97% of the people who are hospitalized, they're not vaccinated. So the level of frustration for these frontline workers through the roof. So Dr. Murphy says, so yes, we're in stage 4, but let's not let our guard down.
But there's still lots of people hospitalized, lots of people in the ICU, lots of people on ventilators. We should be trying to prevent making that worse.
Dr. Murphy says we are still in the middle of the pandemic, and Brian, he is concerned what may happen after the first and second weekend of ACL.